All right, let's dive into a medical mystery. It's one that starts with something incredibly common, a rolled ankle. But what looks like a simple sprain can sometimes hide something way more serious, an injury that gets missed all the time and leads to chronic pain and, even some pretty complex legal situations. It all kicks off with a moment you can probably picture all too well. We've got a 29-year-old warehouse worker. He steps off a loading dock, and his foot just twists right under him. You know that feeling. He gets this sharp, immediate pain. Can't put any weight on it at all. A classic, really unlucky accident. Or at least that's what it looked like.
So he does the right thing. He goes to an urgent care clinic. They do the standard x-rays of his ankle and they tell him, hey, you've got a severe sprain. So he does the whole rest and ice thing. But weeks go by and the pain, it just doesn't quit. And this, right here, is where our real story begins, with a diagnosis that just isn't adding up.
Okay, so let's dig into that first part of the story, the initial injury, and what seemed like a straightforward, but, as we'll see, a totally wrong diagnosis.
So the whole journey starts out pretty textbook, right? The fall, the immediate pain, and a quick diagnosis. It all seems totally routine. But the real kicker here, the thing you gotta pay attention to, is that persistent pain weeks later. That's the first huge red flag that something else is going on, something that the first exam missed completely.
This happens way more often than you'd think. An injury gets slapped with the sprain label, and when it doesn't get better, everyone just gets frustrated. So the real question becomes, what if the proof of the real injury was right there from the start, just overlooked?
And that leads us right to the real culprit in this whole drama, the hidden fracture that was basically wearing a disguise, pretending to be a simple sprain.
So what is this hidden injury exactly? Well, it's called an avulsion fracture. Now, this isn't your typical break right in the middle of a bone. No. Imagine you've got a super strong ligament attached to a bone. During a really violent twist, that ligament is so tough that instead of tearing itself, it actually rips a small chip of bone right off. It's a tiny little piece, but it's objective proof of a really powerful traumatic event. And this exact kind of fracture, it often happens to a small but incredibly important bone called the cuboid. The best way to think of it is like the keystone in an arch. It just sits there on the outer side of your foot and it provides crucial structural stability. It's a tiny little bone that has a massive job. Now here's what's absolutely wild. The most common way this fracture happens, a forceful inward roll of the foot, is the exact same motion that causes a regular ankle sprain. I mean, identical. The foot rolls in, a ligament pulls tight, and pop. A little piece of that cuboid bone gets pulled right off. And that is the absolute core of this mystery. It's why it's so incredibly easy to misdiagnose. Okay, so if the way you get hurt and the first symptoms you feel are exactly the same as a sprain, how on earth are you supposed to figure out what's really going on? Well, it turns into a little bit of a detective story, and it's all about knowing where to look for the clues and, just as important, how to look for them. I mean, just look at this list of symptoms. Pain, swelling, bruising on the side of your foot, trouble walking. You could copy and paste this from a textbook definition of an ankle sprain. It's a perfect disguise. The one tiny, subtle clue can be where the pain is the worst. Is it right over the ankle bone, or is it a little bit further forward over the middle of the foot? That tiny difference in location, that's often the very first hint that something's off. And this right here is the moment the first diagnosis went sideways. An urgent care clinic is going to order a standard ankle x-ray. That makes perfect sense, right? But those images are designed to see the ankle joints, not the midfoot. The cuboid bone can end up being blurry or even completely hidden by other bones overlapping it. To find this fracture, you have to order a dedicated foot x-ray series. It's a completely different tool for a different job. And here it is, the aha moment. With the right test and a specific angle called the medial oblique view, it rotates the foot just enough, and boom, suddenly, there it is, a small fleck of bone, a little white chip just sitting there next to the cuboid. That is the smoking gun. It is the objective, undeniable proof of a fracture. Okay, so we found the fracture. Case closed, we're done, right? Well, not quite.
Figuring out why this distinction is so incredibly important, that's the last piece of the puzzle, especially when it comes to treatment and things like workers' compensation cases. Honestly, the difference between these two diagnoses is like night and day. A sprain, that's subjective, right? It's all based on the patient saying, ouch, it hurts. But a fracture, you can see on an X-ray. That's objective. It's irrefutable proof. And that changes absolutely everything. From your work status, which goes from maybe light duty to complete immobilization, to the legal side of things, where a documented fracture means a much higher impairment rating and a more significant case. And the treatment itself couldn't be more different. For a sprain, you might get an ankle brace for a couple weeks. But for this fracture, you're looking at a whole different level of care. We're talking 4 to 6 weeks, completely immobilized in a walking boot or even a cast. And often you have to stay off the foot entirely. You've got to give that bone the time it needs to actually heal. So, after going through all of that, what are the most important things to remember? Let's boil it all down to a simple checklist you can take with you. So here's what you need to file away. First, if you have a sprain but the pain is really centered over the middle of your foot, not just your ankle, you need to be suspicious. Second, remember that a standard ankle X-ray is often not going to cut it. The key to cracking this case is a dedicated foot X-ray. And finally, never forget that getting the right diagnosis is everything. It's objective proof that totally changes your treatment and any potential legal claim you might have.
And that really just leaves us with one final thought. The next time you, or maybe someone you know, has one of those ankle sprains that just won't seem to heal, remember this whole story, because it empowers you to ask the single most important question you can. Is it time to take a closer look? Thanks for joining me on this explainer.